whenever you attempt to give some guidance, then the first thing you have to do is share your story, because people have to see what happened to you and they have to determine if it relates to them.
No matter what a student comes to my office about, if I have to help them with something, fuss at them about something, whatever, 9 times out of 10 when they leave my office, I always tell them that I love them.
As I say, you can't wear a clown face or a false face in the classroom. It just doesn't work, and kids can pick up on that immediately.
I've spent the last 35 years worrying about my family first and my school next. And I was always last. It's just the way it goes. But after a heart attack, you decide that you have to put yourself first because you want to be around. The day of my heart attack, I got up out of bed and decided I was going to read the last chapter of a book before I started moving around. And I felt a pain in my chest. And I knew that I had had all those symptoms before with stress, because when you're a principal or when you're a teacher and you're dealing with all kinds of issues, you know stress. Within 15 minutes, I had a severe chest pain and my arms went numb. And I called 911, threw my clothes on, and lay on the couch. And I remember when they walked in, they immediately started their procedures. And I just looked at them and said, "I'm really hurting. Can you really help me? I'm really hurting." And I said it over and over and over, all the way to the hospital. Then I wake up and the doctor said, "We put 3 stents in your circumflex artery."
I'm a 3-time heart attack survivor. Yes! I had had a couple of chest pains. Strange, doing laundry was when it happened. I was admitted to the hospital with pneumonia. The next day they came to me, the doctor did, and said, "Debbie, it's not pneumonia. You've had a heart attack. In fact, you may have had 2. There was 100% blockage in my left coronary artery.
At about age 26, one Sunday afternoon, I attracted a high fever, which was very abnormal, and I went to the hospital. They diagnosed that I had rheumatic fever, and this is how all of the heart illnesses began with me.
What's very interesting about heart health in women, I believe we all say it's never going to happen to us. It's always going to be somebody else, somebody we know. But sometimes I think we're just destined to have to go through certain things in life.
Women know that heart disease is out there. Women are predominantly caregivers. They are taking care of mom, they are taking care of the children, they are driving the kids to school, they're going to soccer, they're going to piano practice, they're wearing many, many hats. So when they're wearing so many hats, sometimes they really forget themselves.
I have to eat well, I have to exercise continually, and I have to make good decisions about taking care of myself. The Red Dress Project gives an opportunity to provide more information to more women. There are so many women out there that have no idea what potential outcomes they could have by not taking care of their health.
We as women need more education. We need more awareness. We might be aware of the situation or the illness, but we need to start doing something about it.
When you have screenings, when you have an opportunity to share information with women and give women an opportunity to ask questions, then you're really doing a service to your community.
I just cannot tell you how amazing those doctors were. And once they realized what it was, they did not waste any time. They moved.
I cannot say enough wonderful things about my experience with the Heart Center. They had no idea who I was, and it didn't make any difference. They took me right through the emergency room, right to the cath lab, and they started their procedures, and I felt so relieved.
You need to be concerned about your health. Go to the doctor, take the test. Do whatever your doctor has recommended that you do, because I say quite often you only have one heart. And when it stops beating, that's the end of life.